Thanks so much, everyone, for watching. We've got an epic lineup tonight of speakers. We've got an awesome panel here. Amazing group of functional doctors, technology, activists for a leap forward in medicine.
This is a great gathering.
You know, our goal is to make it easy for practitioners to learn in community. There's a lot of community happening tonight. I want to say welcome to all of the communities that are watching at home. This ecosystem that is being set up by the meetup groups, we believe will be the future ecosystem of this evolved primary care network that we are looking to develop, and it all revolves around you. There's an exponential potential to the future of medicine. This is an allopathic conversion machine that we have just created. And it has exponential potential because it can be seen by 1 billion people at no extra cost. That's the beauty of the internet.
Welcome to the Functional Forum. Thanks for joining us in the charge to accelerate the evolution of medicine. Please welcome your host, James Maskell.
Hello and welcome to the December Functional Forum. In this episode, we're going to round up all of the best clinical information from all the content that we've made this year. We've done 12 regular functional forums. We've done 3 special live functional forums from the Royal Society of Medicine in London. We did Journey to 100 in June with over 8 hours of content. We did a whole digital summit in August called Interpreting Your Genetics, and over 50 podcasts. Now, one of those podcasts was with Dr. Yael Joffe, who live interpreted my genetic test. And so you're going to find out now why I don't necessarily travel to a different city every month for the Functional Forum. It was in that session, and you're going to find out about it now. Enjoy.
Can you see where it says factor 5?
Yeah.
Now, factor 5 is a very interesting gene. And when I saw this, I was like, well, if we have a conversation about one thing, it should have been about this. So factor 5 is in blood clotting and thrombosis has a kind of a cascade where one enzyme kind of generates the next. And there's a whole lot of clotting factors that kind of manage the thrombosis and clotting. And factor 5 is one of them. And factor 5 is one of those where it doesn't have a nutrigenomic input. There isn't a dietary advice I can give you, but there is lifestyle advice. And it's a kind of a strong gene, this one. I don't know if you've ever heard of like the traveler's gene, or, you know, you hear stories about someone who was like super fit, super young, flying back from Australia and had a DVT on the plane coming back, even though they were like super healthy and super young. So often this is factor 5. So, you know, there's some people who've kind of built these traveler genetic tests and they always have factor 5 in. And when I thought of you, I was like, oh my God, you spend your whole life traveling.
Yep.
On long journeys or long flights. This is an absolute marker for you, James. This is like a non-negotiable, right?
Okay, tell me.
So it really is all about long distance travel. So if it's flying or sitting in a car, you have to apply all the precautionary things you can. So it's flying socks, it's moving around, it's doing exercises where you're flying. I don't know if you have a doctor that you work with. If you're working with me, I'm not an MD, I would suggest taking half an aspirin before you fly, before you go on long trips, every single time. So the great news is you only have a 1 copy of factor 5, not a double copy. But it's a little bit stronger than a nutrigenomic SNP.
I've actually noticed sometimes that the gout thing comes on after a long travel. Could you see that could be, you know, there could be inflammation caused by that?
I'm not gonna take a flyer at that. I would have to think about it.
Okay.
Especially with all the smart people who are going to listen to my conversation. I'd rather not throw out an answer.
I noticed that I did start to think, oh, this really comes on when I travel, and I've seen it. Like I had it both times when I've gone to England. I've like had it, and it's kind of embarrassing because there I am trying to do some work event. I'm hobbling around, and I was like, you know, why does this only come in England? Maybe it's, you know, I'm not eating like pies and stuff while I'm there the whole time. So what's going on?
Yeah, I think gout obviously is very strong around inflammation and oxidative stress. We know that you have some issues around oxidative stress. Traveling, the pressure is always inflammatory. I mean, that's why your feet swell when you travel. So it's very, very pro-inflammatory, which is one of the dangers of having factor V and having such an inflammatory environment. So there's no surprise whatsoever that your gout would manifest on long trips. But for you, and I would say, you know, this is also something to think about in terms of your family, because this factor V came from somewhere. It was given to you by one of your parents, is that, you know, when we talk about healthy flying and all the precautions we should take, like I've just mentioned, moving around, standing, walking, wearing flying socks, half an aspirin, lots of fluids, you've got to do it. It's like a non-negotiable, because this isn't a chronic disease issue. This is a acute thing.
Okay.
Great.
Awesome.
So what you're going to see in this 2017 clinical roundup is that this is a truly international flavor now at the Functional Forum. We have meetup groups in 6 continents, and now on this segment we have Dr. Heba El-Nazer, an Egyptian integrative physician, speaking at the Royal College of Medicine in London from the April Functional Forum from the Royal Society. So in this session, she's going to talk about 2 case studies, one of Hashimoto's thyroiditis and one of MS, that are completely resolved with functional medicine. Take it away.
So the first case is a 21-year-old lady with known bipolar disorder and major depression since her teen years. She came in to see me with the main complaint of being tired all the time, having generalized aches and pains, and she has been unable to concentrate for a very long time. Now, I always like to ask patients, what is the most pressing concern? Because this is usually the thing that gets the patient to come and see you. And for her, it was her cognitive impairment, and it was very progressive and very intense, to the point that she had to drop out of school. Her past medical history was insignificant, except for mentioning some childhood viral diseases, flu, and just very, very general stuff. And she also gets some episodic allergies. She saw a lot of different conventional and holistic care practitioners, and they ran a lot of tests, immune tests, food allergy tests, a lot of blood work, and the only thing that came out positive was that she had a very low vitamin D level in her blood. She also, some of the physicians she saw before recommended that she does EMG and nerve studies just to make sure that the muscles and the nerves are working well, and they came out negative as well. And the final diagnosis that she got was that she has fibromyalgia, and it explains all of these symptoms and concerns that she's been sharing with us. Of course, she was put on medications, but she didn't stay on any of them because she didn't feel it was helping her. So as I was getting to know her better, and we're tying in all of these symptoms, and as I said, the history and the story is the diagnosis in 80% of the time, and investigation is just confirmation more than anything else. So tying in her history of viral infections, allergies, and vague neurological symptoms, a high suspicion of a non-visible autoimmune process was appropriate, specifically for her age, multiple sclerosis. And there is a lot of studies and research papers every day now that tells you that for years before the official diagnosis of multiple sclerosis, there is a lot of patients who manifest with depression, bipolar disorder, and they're not responsive to medication. So before we enrolled her in a year-long program, we did a brain MRI, and there was something that we call CIS, clinically isolated syndrome. And this is not a very common term, but this is basically, some authors say that this is a precursor for multiple sclerosis or a very early stage of multiple sclerosis. So she was enrolled in a year-long program, and the treatment goals were set with the patient. And so this is what we do at Revive. Of course, we do the whole integrative medicine approach, where we talk about nutrition and we talk about lifestyle choices such as stress management, sleep, exercise, supplements. But there's a couple of things that we do a little bit differently. And number one, we always do a pre-planned visits. So we always like to have milestones, and we sit with the patient and decide how many times she's going to be coming out initially, and this gets spaced out after that as we go along the treatment plan. The second thing is most of the patients that come into Revive are chronic complex disease patient, because this is the kind of patients we see. We don't do just regular primary care. So most of them are in medication. So we do a lot of approaches about how to play a little with the medications and decrease those that are not needed. And if the patient has to stay on a medication, we need to give them other stuff that will decrease the side effects of the medication. And the third thing is disease-specific therapy, because we found that with a lot of diseases, there are very specific therapies that would help with the prognosis of the disease and will help with the reversal of it. And in her case, for instance, neurorehabilitation and cognitive exercises and physical therapy was very important to trigger neuroplasticity and reverse the muscle rigidity that she had as well. So after a year from being with us at Revive, what happened was her MRI findings showed stable findings. There was no more lesions, and her symptoms disappeared. The cognitive improvement was so good that she was able to re-enroll back into her school. And now she's an educated patient who knows what works for her, what works for her body, and knows how to carry the kind of life that she wants to carry. The second case is a 40-year-old gentleman who's known to be having hypothyroidism all his life due to Hashimoto's in his early years, in his 20s. He's been on levothyroxine, hormonal replacement therapy for thyroid. And he came in complaining of general symptoms, including fatigue and generalized pain. But his main and most important concern was weight loss resistance. And he was so surprised by this because his regular exercises, he's a vegetarian, he does not smoke, and he does not drink alcohol, and he just doesn't know what to do. So his past medical history was uneventful except for some seasonal allergies. And on assessment, what we found out was that, of course, like some of the things that patients think are healthy are not really healthy when it comes to food. So this was a part. And the other thing is he had very high antibody titer for the Hashimoto's. Despite the gland being non-functional for like almost 20 years, the antibodies are still very high. His serum lipids was also completely out of normal ranges, especially the serum triglycerides. He showed a typical picture of metabolic syndrome with a high CRP and homocysteine, uric acid, and mild degree of prehypertension and also prediabetes. So what happened was we enrolled him into our care programs, and for the first month, what we decided to do was to give him the proper supplement, put him on anti-inflammatory diet to bring down the inflammation, and to give some supplements that would help with. He had also vitamin D deficiency, and we also wanted to work on the gut a little bit because of the autoimmune markers that we found were positive in his case. And after that, he did not get better. Things kept on getting worse. And his hemoglobin A1C went from the pre-diabetic range into a full-blown diabetes. His triglycerides went so high in the 700 ranges. I don't know what the conversion for that is, but it was really high, although the LDL cholesterol actually normalized a bit with his supplementation and dietary plan. And he still couldn't lose weight. So this is where, and this is a very good example for physicians, because functional medicine, integrative medicine is not against medication, but it's against the principle of giving medicines without understanding if the patient needs it, and without understanding how long should he be on those medications, and whether or not there are any side effects that I need to watch out for. So what I was worried about with his case is that his pancreas was under attack from 3 different levels. Number one, the intense insulin resistance with very high levels of insulin I was worried that it would make him go on the verge of being completely insulin depleted, which happens to a lot of the patients on type 2 who have type 2 diabetes and are on oral hypoglycemics, and they need insulin at a certain point. This is one thing. The other thing is we diagnose him with something called insulin resistance type B, which is very common in patients who have autoimmune diseases, and it basically has a lot of different antibodies shooting different kind of organs, and it's very difficult to treat this with just lifestyle modification. And the third thing, the high triglyceride levels was putting him as a very high risk of developing pancreatitis. So this is where we decided to put him on medications for a couple of months. We put him on metformin for the insulin resistance, which is a diabetic medication, fenofibrate for the triglyceride, and we were still also combining the supplementation regimen that he was on. Alpha lipoic acid, probiotics, chromium, magnesium, all of these things that would help with the insulin resistance. After 3 months, he was off the medication. He was able to lose weight fantastically, and his antibodies dropped. And a year from now, from then, he's still very healthy, and he's just coming in for just regular follow-ups and sort of like a health preservation kind of thing. So what I like about this example is that it just talks more to doctors about the use of medication in the integrative medicine setup, that we still can do that, but we need to have a roadmap on how to do it.
If you haven't recognized the theme of this month's Functional Forum yet, it is female physicians and clinicians roaring in 2017. And no one has roared louder than Dr. Isabella Wentz. Her book, The Hashimoto's Protocol, was a #1 New York Times bestseller. And she spoke on the February Functional Forum about the 5 stages that get to Hashimoto's thyroiditis. There is so much to learn here about the progression of chronic disease. It was a great talk. Take it away.
So, one important thing to note with Hashimoto's is that it's not like black and white. It's not like you just have it full blown or you don't have it. There's actually 5 stages to Hashimoto's. In the first stage, for all intents and purposes, your thyroid function is normal, your immune system function is normal, and you're not going to have any symptoms, right? This is just the genetic predisposition. The second stage is when things start to change. So we start seeing an infiltration of white blood cells right into the thyroid gland. And people can start seeing changes in thyroid antibodies. So you might see thyroglobulin antibodies or thyroid peroxidase antibodies in this stage, but the TSH will still be normal. The other interesting thing is there's also seronegative Hashimoto's. So some people don't even have thyroid antibodies, and doing a thyroid ultrasound or a biopsy might be another way to find thyroid disease. But really, unless you biopsy every single cell within the thyroid gland, you can't tell if there's white blood cells in there. So it's really not something you can necessarily exclude by doing thyroid antibody tests. The other thing is, in this stage, there's just beginning attack of the thyroid gland, so the thyroid tissue may still be intact, but the body's already compensating. And this is when we start seeing symptoms. So people in this stage are going to have the panic attacks. There's multiple studies on the different types of symptoms that are correlated in this stage: obsessive compulsive disorder, panic attacks, anxiety. One of my favorite one was health-seeking behavior, hypochondria, right? And a lot of times, traveling the country the last year or so, I've interviewed over 60 patients with thyroid disease. And through my platform, The Thyroid Pharmacist, I have over 300,000 people that follow me online, my clients and whatnot, and they all share the same stories with me. Is like they were going to get care. They were trying to seek the help, but people were just telling them that there was, you're crazy, here's an antidepressant. You're just fat, you have fork and mouth disease, you need to eat less. These are true stories, right? And then that's stage 2. Now, if you can get a person diagnosed in this stage, you can prevent a lifetime of fork to mouth disease. You can prevent a lifetime of depression. And you can also prevent the need for thyroid hormones or thyroid medications, because you can, while we have some technologies that can reverse and accelerate tissue healing, it's much easier to prevent damage on a thyroid gland than it is to regrow new tissue. Stage 3 is when more progressive doctors are starting to diagnose people where a person will have subclinical hypothyroidism, and they will also have slightly elevated TSH, and then they will have, the thyroid antibodies or not. And at this point, we start seeing more and more symptoms. We know that treating people with thyroid hormones at this stage can also be helpful. For pregnant women, this is usually a must, but in the conventional world, whenever a woman who's not pregnant comes in with a TSH, 6, 7, or 8, she's told to wait and watch. To wait and watch for what, right? For it to get worse? And so stage 4 is overt hypothyroidism. This is when most people get diagnosed, right? And at this point, they are prescribed a medication. I think we all know the brand name levothyroxine. It was the #1 prescribed drug in 2 out of the last 3 years. It finally got beat out by Vicodin last year, right? And this is something that they're getting. But many of them continue to have symptoms with this medication. And they're told, oh, well, your thyroid's got nothing to do with your hair loss. Your thyroid's got nothing to do with your weight gain. And your thyroid has nothing to do with your depression. And the scariest part is that this medication is not only, it doesn't really help the symptoms that it's supposed to treat, but it also doesn't stop the progression of the condition. So we know that Hashimoto's, like every autoimmune condition, is progressive. And so stage 5 is when we start seeing progression to other types of autoimmune conditions. I've talked to so many people around the world who were good girls. They took their thyroid medications. They did everything their doctors said. And then they were diagnosed with rheumatoid arthritis or lupus or another type of autoimmune condition because the root cause, the trigger, was still there. Nobody was doing anything about it.
So now that we've heard from all of the clinicians about how to do this great medicine, how do we fill the gap between what's possible and what's actually happening in practices? And this gap was first talked about by Andrea Nakayama back in the January Functional Forum, and she is the founder of Holistic Nutrition Lab, now the Functional Nutrition Alliance. And check out this 5-minute talk that she did in the January Forum about the gap and who can solve it. Enjoy.
So we all know that there's a problem in healthcare. The patient is getting sicker and sicker, and there are fewer and fewer practitioners that are able to meet the needs of this growing population. Yet the functional medicine practitioner is up to the task. And still, there is a problem that we're all facing in functional medicine, and I have the solution for you. I want to share the solution with you tonight, and the solution isn't the cure for cancer. It is not root cause resolution to small intestinal bacterial overgrowth, but I promise you the solution that I have for you will address those problems and more. In functional medicine, the problem that we're experiencing is what I'm going to call a gap. There is a gap in the functional medicine model. And if you'll play with me here, I'd like to ask you to close your eyes a little bit with me, thank you, so we can imagine this model. So in your mind's eye, I'd like you to imagine a pyramid or a triangle. And at the top of that pyramid or triangle is the functional medicine physician. And this physician can see the entire terrain. They understand the importance of the functional medicine timeline and collecting a clear history. They understand the importance of the matrix and the web of interconnections. And they appreciate the role of diet and lifestyle modification in the care of the patient. And yet they don't necessarily have all the time they need to address habit change and all the things that might come with sociological, economical, cultural changes that that patient needs to make to adhere to those principles or therapies. So in this model, the physician is like the CEO, and that functional medicine physician may be you. At the base of this model or pyramid, we have the patient. And the patient is understandably caught in the weeds of their signs and symptoms. They don't have the knowledge to understand why they're doing everything they're doing or being asked to do. And they're really just working to try to keep up what they can do to feel their best. So, okay, we can open our eyes now. The patient that we see at the base of this model is really the hero. They're the worker doing all the work day in and day out. And this triangle that we all envisioned, that is the therapeutic relationship that we talk about in functional medicine. And yet with the practitioner, the physician at the top and the patient at the bottom, we have a gap. And it is in part that gap that is contributing to the patient getting sicker and sicker because they need a better understanding. They both need help in closing the gap. And it really is the job of a specially trained practitioner to fill that gap. And this is the solution I have for you. This is where I train what I call the allied functional medicine practitioner in the art and science of the functional medicine practice. So this is where Holistic Nutrition Lab, my training program, comes in. But more importantly, the practitioners that I train, they fill that gap for you. They understand how to speak the language of the physician, how to understand the physiology. Holistic Nutrition Lab is the only training that goes beyond specialty diets and understanding dietary theory. It goes beyond coaching to be able to speak the language of both the practitioner and the patient. So this is where we come into what I see the practitioner that's trying to fill in that gap falling into what I'm going to call traps. I call these the IQ traps. So we talked about a gap, but then the practitioners in there are falling into several traps. There are 5 IQ traps, but I don't have time to share them all with you tonight, so I'm going to share 2 of them with you. One is the information trap, and I think we can all relate to this. So many of the practitioners, the allied functional medicine practitioners that I see, are trying to just gain more and more information outside, in books, in trainings, in online telesummits. The information that we need, first and foremost, comes in the therapeutic relationship. It comes from the patient, but that practitioner needs tools, systems, and the frameworks that I've developed to be able to know how to ask the right questions to gain the right information. Another one of the traps is the quick fix trap. Now, if these patients could be fixed with a quick fix, they would have found it already. They wouldn't be looking for you, functional medicine practitioners, to help them. So you are not the hero on the patient's team coming to the rescue with the quick fix. The hero comes in being able to dig, in being able to help them understand that whatever got them here is going to take time to reverse. So like I said, there are 5 traps that I've identified. Those are 2, and we need to work together as a community in partnership to create the therapeutic relationship that doesn't have gaps. So like I said, I believe that my practitioners are the solution to that gap. The paradigms that I've developed are really what help people work into those gaps. But there's a first step that we can take, and I'd like to invite you all to take that first step. It follows what Dr. Jeffrey Bland was talking about in terms of genetics and the epigenetics, and I'd like to invite you to get my Epigenetic Mastery Primer, which you can get at GoEvoMed.com/mastery, and this is how we all start to work in partnership in the therapeutic relationship, practitioner and patient, to really address the terrain and change and fill that gap. Thank you.
So 5 incredible clinicians, all female, starting off the Functional Forum. It's been a great year. And so people ask me, what are the plans for 2018 and how can we get involved? So first and foremost, we want to grow our meetup ecosystem all across the world. We have meetups now on 6 continents, and we have almost 1,000 that have registered, but we want to get more operating regularly. So whether you've been to a meetup before or if you've never hosted a meetup, now is the time to go to meetup.functionalforum.com, register a meetup, show up to a meetup, start to build the ecosystem of practitioners. We really have some great momentum. If you get 20 people to your meetup and you're in America, we will send you a case of wine from Dry Farm Wines to kick off and make the most out of the impact in your community. So check that out. So one of the major tools that we've used to make our Functional Forum meetup group successful is Eventbrite. Now, Eventbrite is an event technology that makes it super easy to put on events anywhere in the world. And so what we found is that by practitioners either using Eventbrite for their local functional forums or practitioners using Eventbrite to host local patient education events, it's a great way to get the word out there and become the go-to expert in your community. So if you're looking for more new patients in the first quarter of 2018, or if you want to be just the go-to expert in your community, you can use Eventbrite to get known, set up events, find local people who are interested in the kind of medicine that you're delivering. So if you want to learn how to do it, we've set up a free webinar that teaches you exactly that. Go to goevomed.com/eventbrite. You can look at the link here below. Go to that site. You can register. We're doing a few different sessions this week and next week. You'll be able to learn exactly what to do, how to set up Eventbrite, how to set up the events for your practice, whether you're looking to build a practitioner community or whether you're looking to get new patients into your practice. Check it out. Enjoy. One of the most powerful segments in this year's Functional Forum came from the June Functional Forum, The Evolution of Neurology. A pediatrician from Northern California, Dr. Nicole Shorrock, shared her very personal journey to functional medicine, and it was shared so many times on social media that we had to put it on this show. Check out Dr. Nicole Shorrock.
6 years ago, my husband was diagnosed with MS. This seemed to come out of the blue. He seemed healthy to me, and I was shocked. And yet we found ourselves in the neurologist's office being told that he would need to use daily injected immune suppressive medications to prevent decline. I was terrified, and I knew that fear would fuel the illness. So I focused on letting go, surrendering, and allowing myself to experience the vulnerability of this diagnosis. When that happened, something changed in me. I realized for the first time that I didn't believe in the conventional medicine approach to chronic illness. The way that I'd been trained and the way that I'd been practicing, when it came down to it, I couldn't rely on it or trust in it to care for my husband. I have always been open-minded, and I knew intuitively that nutrition was important and mind-body medicine was powerful. And when the neurologist said these things didn't matter in the course of his illness, I knew that we needed to go elsewhere. I started studying, I studied extensively, and I found Terry Wall's protocol online, and we got started. It was really basic, nutrition, yoga, and meditation, but the results were profound. He recovered within a few weeks, his symptoms completely resolved, never to return. This experience profoundly changed the way I practice medicine, because as I witnessed my husband's evolution of health and wellness through functional medicine, I knew that I could not accept anything less from my patients. And through the journey, I found IFM and dived into functional medicine. I've been practicing full-time pediatric practice, caring for children with neurodegenerative conditions, recovering autism, ADHD, depression, bipolar, anxiety, sleep disorders, the list goes on and on. I know that we're in the middle of an epidemic of neuroinflammatory conditions, and it's incredibly rewarding to have tools through the functional medicine matrix and training to heal the children. It's a blessing that I am grateful for every day. It is my hope that as we heal the children, we heal the family, and ultimately empower our patients to heal our community.
Wow, wasn't that such a powerful story? Because of the power of that story and many other issues, we have decided to do the evolution of pediatrics as our January Functional Forum. So join us on January 8th for the evolution of pediatrics. And in February, we will be bringing you a special conference called Prescribing Lifestyle Medicine from London, England. It's the first conference that's ever been endorsed to do with anything with functional lifestyle medicine by the Royal College of Physicians in the UK. And it will star Dr. Chatterjee, Dr. Ayan Panja and Dr. Michael Ash. That'll be one not to miss. So whether you watch at home or whether you watch as part of our community, thank you so much for being part of our Evolution of Medicine community. We really appreciate having the opportunity to serve you and your practice, building the practices of the future. Thanks so much for watching, and we'll see you next year.